Well, just going on from this tragic catastrophe, I've got on the line via Skype Tim Hicks. Tim is the Acting Chief Advocate for Leading Aged Services. Tim, thank you for your time. This is a dreadful catastrophe. So providers, and there are over 800 across Australia, are not getting the support that they need.
Well, the problem, Alan, is that a lot of supports have been announced, but those supports haven't necessarily been flowing through. So we've had the Health Minister announced a few weeks ago that 4 million masks would be made available to aged care providers. That's taken weeks to come through, with services being turned away when they request masks because they're almost running out. So what we've been calling for is additional resources to make sure that the measures that have been announced are actually implemented. We saw some movement on Saturday with a new response centre being announced, bringing in the military to help with some of the logistical challenges that services have been experiencing. But it's too early to tell whether that's actually going to have the intended effect.
But Tim, what about staffing levels? I mean, it seems to me, from what I get and what I read and what people are writing to me about, the staffing levels are woefully inadequate.
Well, staffing in aged care has been a major challenge even before the pandemic, and we've been strongly in support of the calls from Council assisting the Royal Commission to increase the number of staff in residential aged care services to deliver a higher level of care. But in the context of the pandemic, those issues have just been amplified. As you said in your introduction, Alan, lots of staff are having to stay home because they're symptomatic or they've been exposed. And now we've got this single site initiative, which is has a laudable objective of reducing cross-infection risk. But of course, when someone goes to work at a single facility, the other facility they were previously working at needs to find some new staff to fill the gap.
Amazing. But then what about families? I mean, surely to God we could at least tell families about the fate of their loved ones. I mean, you know, and everywhere at St Basil's, I just heard that thing there, they can't even clean out the bins.
Well, I think that's just a reflection of, in many ways, the issues people are facing around staffing. Look, communication is absolutely key to this, and cleaning as well. I mean, both of those things are an absolutely essential part of any service's COVID-19 response. And if we're seeing those sorts of issues, I think it can only reflect the challenges everyone's experiencing around getting access to the staff that they need.
But see, Tim, Scott Morrison said on the 15th of March this year, addressing Australia, for older Australians and those with pre-existing health conditions, our aim is to protect the most vulnerable. That's not happening.
Well, I think it's an incredibly difficult thing to do. As you said, when you've got asymptomatic cases and vulnerable people who need care, need close personal care, there's only so many things that we can do. I think we've now got a lot of the measures we need in place. I think the precautionary use of masks in aged care services is an incredibly helpful step towards minimising the risk of that transmission, as is this measure we're now implementing around working at a single facility. But what we're seeing right now is in many ways the consequence of those measures not being in place. Yes, we'll have to wait a little while before we actually see the results of putting in place those protections.
All right, Tim, good to talk to you. Tim Hicks, I should say to our viewers that the Royal Commission in its interim report in November said the failure to care adequately for our aged community diminishes us as a nation. No doubt about that.